Hey ho, it's Pauliano here from Tangmere Dental Care near Chichester. We've unboxed a couple of LEV external suction units that we're going to be testing against each other one at a time. I did order one of these units very early on during the lockdown, the vac station. This one's actually the DentalAir. On paper this one looked like a better deal, but as I got the other one I thought I'd do a direct comparison which hopefully will help some of you guys out there. I am looking at aerosol mitigation here, about reducing fallow time. I mean, there's bound to be some leakage around the sides, and in a way that's what this test and this video is about. So we're all going to be having to wear our PPE, but the hope is that we can reduce the wait time between patients and make things just a little bit more streamlined and not having to leave surgeries empty for any period of time. So in these tests I'm going to be using Vapesmoke because that's a visible aerosol. It does seem to, on the particulate meter up here, generate particles, measurable particles that are measured in the filtration statistics of PM 2.5, PM 10 and PM 1.0. They are just basically different particle sizes. PM 1.0 is the finest, very, very fine dust. I have actually already measured some baselines using no mitigation features at all in effect, and this one is simply going to be using the LEVs with no other systems actually turned on. I'm going to get Susie in a moment to blow some smoke, and we're actually going to be trying for failure. Now I'll just point out, Susie is in my social circle. This is a nicotine-free vape, and also the surgery is going to have a good deep clean before it's next used. After we've done these baseline tests, I'll be putting the winner up against some real aerosol generated from the turbine and also from scalers, because as we know, the Vapesmoke is not going to be absolutely similar to real dental aerosol. So Susie, come on in. We're all set up, just check the timers on and check the cameras are all on. Yeah, that's all running. Okay, so it all looks good to go. So what we're going to do then is I'll get the DentalAir going. I'll just check that it's on 100%. So using the handy little remote control here. Okay, so we're just going to be trying for failure in this particular test. What I'm going to do is just adjust this so that this is actually a working height. So I can get my hands under here comfortably, and that seems to be in a good position. I'll be able to work here quite nicely. Susie is going to be blowing the smoke up, so obviously that's quite unnatural. So to see if we can actually cause these to fail. And so, right. The actual particle readings at the moment are nice and low. We are looking at the PM10 value because that's the bigger droplet size that might carry more viral load to actually be able to infect people, more like a cough or a sneeze. But all values are below 10. We're looking at this PM10 to come back below 10. I'll start the timer when Susie has done her 5 breaths. We'll do 5 breaths blowing and then 5 normal breaths out. We'll actually see hopefully what happens at the unit. Alright, so Susie, off you go. And if you can let me know when you've done the 5 breaths, I'll do the blowing first. That's it, so you can see the smoke coming up. Just having a little look at the particle meter. Trying to get it outside there, Susie. I'll waft around to simulate a little bit of movement of the nurse and the dentist. Yeah, we're getting some readings going up here. 5, okay, let's start the timer. So that's really sort of trying to push the smoke past the shield here. So of course that's a little unnatural. we did get readings spike up to 200 or 300. I'll have to have a little look back on the video and see what the maximum readings got to. There we go, that actually went down below the PM10 equaling 10 micrograms per meter cubed, and that was in 1 minute 36 seconds, so that's actually pretty good. If we sort of actually take Vapesmoke, which actually does seem to give quite good readings in comparison with the turbine. The only thing is, I know, having done one of the turbine tests, that the particles must be slightly finer or something, because they seem to hang around for a while. So I'll do, as I said, a test where we're comparing this against the turbine itself in a similar situation. So if you want to be seeing those videos, the usual YouTube thing, subscribe, hit the like button, and you'll be notified about when that video actually is released. Okay, so next test is just zero. I'll reset this. This is going to be doing just normal breaths out through the mouth. Right, Susie, if you can go. I can really see that smoke being drawn straight up there, so normal breathing. I doubt if that's actually going to do anything, but you know, that's the thing, isn't it? And it's going to depend on positioning of this, and obviously the shape of this. I love this sort of aerosol here, which you can see through beautifully, and the suction of this does seem to be a bit more powerful. It's a bit noisier, but it's a bit more powerful. I'll be measuring all those things on future videos. I'll just waft around as I did in the last one. I'll turn the stopwatch on. Try and waft around, see if we can get any readings at all. Right, as I predicted, I'll just stop this because I'll just try and see if we can get some here. But of course, the particulate meter here is at my working height, so this is where I would be breathing, and you know, and obviously that's not gone up at all. So really, I can stop that. We had no increase in aerosol particulate readings at all, which is very, very encouraging. So if this is placed in position when the patient is breathing or coughing or whatever under normal circumstances, especially with other mitigating features, I think we've got to go for worst case scenario here, that there might well be something escape. But you know, even trying, we actually got the baseline level back down within 2 minutes, guys. Now that is really exciting. So I'm really keen to see what the vac station does, so I'll be doing a similar video very, very shortly, where I'll be doing a almost identical test, all being well. So until the next time, thank you very much for watching, guys. Cheers.